Hello, we are the Utah END Institute. We have some of the administrative board here today, and then we also have Max, one of our students. So we'll just real quick introduce ourselves. My name is James Nider. I am the manager for the neurodiagnostic lab at the University of Utah Hospital and have an administrative role in this program. My background is in nursing. This is not my specialty.
I'm Chris Halford. I'm the program director. My clinical background is in neurodiagnostics, specializing in the operating room. I mostly deal with the didactic work of the program.
My name is Maxwell Perry. I'm currently a student here at the END program, and I work here as well.
And I'm Karen. I'm the EEG lab supervisor, and I'm also the clinical director of the program. I'm the one that is usually teaching how to run an EEG. So this is our administrative board of members. So these are some of the physicians that teach in the program and some supporting staff.
So there are 26, 27 programs, I think actually now, in the U.S. And you can see ours there in Utah. There's a large catchment area around our program. We do have a lot of outside of state interests. We've had people relocate here for this program. But there's not near as many programs as there ought to be in the country. There's a huge variance between the job demand and the graduating students every year. So definitely a big need for these programs in the country right now. You can see us there. Just a quick story on, this is my father-in-law, his name is Doug. I just wanted to give you guys a visual of what our program does for the patients that come through. So a lot of what our technologists do is work with patients that have epilepsy. So they'll be from start to finish in a lot of cases. So on the diagnostic side, and then our techs are also involved until, the surgery and aftermath of that. So Doug was working on a ladder one day. He fell off, hit his head, and had a traumatic brain injury. And from that developed epilepsy. The type of epilepsy he had was absence seizures. And so he would basically space where he was. He wouldn't be able to recognize close family members, or colleagues that he had worked with for years. And so you can imagine what this did to his work life and just basic functioning. He wasn't able to drive or work. So he came through the University of Utah program, received his diagnosis, eventually went on to Intermountain and had his surgery with Intermountain. And he's been seizure-free ever since. So he was able to go back to work. He was able to run a home-based business for a lot of years and then ultimately retire. So we were able to get his quality of life from where it was, basically non-functioning, to a high-functioning state again. This is what we can do for our patients that have these needs.
I know a lot of you guys are probably wondering what is it exactly that we do. We do a slew of tests, starting with EEG. That's our bread and butter. Karen here, she shows us how to mark, measure, do a full hookup on a patient. This is often patients with epilepsy, as James mentioned. We have another crew in the long-term monitoring unit that just looks at the patients that we hook up after, and they fix leads and stuff as needed. We also do a transcranial Doppler on potential stroke victims. We do a bubble test on patients that may have a hole in the heart. And then there's intraoperative monitoring, which is done in the operating room, making sure surgeries go properly, making sure the doctor's not pinching any nerves. Throughout the program, there's different hospitals we train at, one of which being the U of U. We also do Intermountain. And we do children's primary as well. So those three are like major hospitals here in the state of Utah, and we train at all of them. We can work at community clinics, private practices, other medical facilities, and we even have travel. And as I mentioned before, operating room. This is my current class. You can see me front and center there. Love my class. We've become more like family, and the two doctors there, Dr. Orion on the left, Dr. Blake Newman on the right, and Karen's there in the back, and Chris and James. They're all just really, really helpful. Besides being family, it's an open door policy. You can come there, you can talk to them, You can ask them what you can do better every day. Questions on homework, anything they'll help you with.
This is just a quick look at salaries for this position within the Intermountain states. I'll just show them all here real quick. You can see the mean and median salaries for each area. So all respondents' mean salary was about $70,000. Supervisory positions were 80s. And then the OR position that we've highlighted on a little bit was in the 90s. These are not starting salaries. Starting salary is low to mid 50s, but techs can work their way up rather easily, and there's lots of different avenues for progression in this area. But these salaries are definitely very competitive with nursing, but really with neurodiagnostics, your investment in time for training is far less. So this program starts in August and goes through May, so it's just 2 academic semesters, and then you can sit for your national registry exam. So you're making good money after 2 semesters versus nursing that usually requires at least a few years of prereqs and then a 4-year program. This is a great return on your investment for your education. This is a slide that was prepared by the Bureau of Labor and Statistics, and they took a look at the area, the job area in the country that adds the most jobs for all jobs in the country. So this is if you were to look at everything in sales and service industries, and of all jobs out there, healthcare practitioners and technicians, technologists, add more jobs than any other job type. So these are basically hospital, clinical jobs that are not nursing or physicians. And you can see runner-up there is also healthcare support. That's shows that it's a great time to be getting into healthcare. This is a similar look, just you can see the growth for all jobs in the country at a strong 6.5%. And then in our area, in these technologist jobs, 23% growth over the respective years that are noted there on the slide. So tremendous growth in this area for the country. These are the types of jobs down here that it's referring to.
So there's different kind of pathways for you to become a registered tech, but the one that we do is pathway 1. So that is an accredited program, which we are. You do have to have current CPR BLS certificate. And then there is a requirement before you can take your test of 50 EEGs that need to be done. And those get done during clinicals.
This is just a list of the course instructors in the program. You can see there's a strong physician presence in the program, lots of technologists, even some nursing staff. And then there's other staff such as biomed, IT. We have a neuropsychologist that instructs in our program. A lot of variety of instruction with literally hundreds of years of experience on that panel. This is just a look at our tuition compared to other like programs throughout the country. So with our program, there are certificate programs and degree programs. Really, there's a lot of added fluff in the degree programs. They are more costly. There's a lot of non-essential stuff in there just to kind of stretch it out to be a degree. I know we may sound a little bit partial, but really what employers are looking for is the national registry. And that's what our program is aimed at doing, is preparing our students to successfully pass that registry. And we have great outcomes. But the national average for tuition for these programs is $13,000, and our tuition for this year is $7,200. I do believe this is actually an old slide. Orange Coast there is actually quite a bit more than what is noted there. We actually are pretty confident that we have the lowest tuition in the country right now. And we are not doing this for money. Really, we're trying to cover our costs to run the program, but the whole intent and focus of what we're doing is trying to produce good quality technologists to work in our field, because there is a huge need.
And our outcomes are great. This is the outcomes from 2019. So 92% graduated. The ones that passed the registered EEG tech, it was 89%, and they all had jobs. So one of the things as people get in the program, and people who really want to find a job, usually through 2 to 3 months of being in the program, they usually have a job. And even our last class, when it comes to passing rates, so far everybody that has taken the test has passed. So from our last class, we have 100% passing rate. And
we have not posted our 2020 outcomes because We have had a few students that elected not to test yet, or at least during the COVID months, they're still planning to do that. But like Karen said, we have the solid pass rate for that group. Still good job placement and graduation. So we continue to maintain high outcomes.
And we also have an articulation agreement with the U, of course, and Weber. So at the University of Utah, what we do is you get 30 credits towards kinesiology. So also we have an articulation agreement with Weber, if any of you guys are interested. So what happens is if you do our program and you become a registered tech, you can get 30 credits towards a Bachelor's of Integrated Science. And if you guys have any questions, please feel free to contact any of us. That's our cell phone numbers. That's our email. So just let us know if you guys need anything.
And if you're looking to contact Karen, do so after 11 p.m.